Hello, my name is Colleen Salty. I'm a clinical dietitian and I work in a hospital in South Florida. Almost every day I speak to patients that have been put on the blood thinner called Coumadin or Warfarin. It's part of my job to explain to them what type of dietary guidelines they need to know about when they're taking this medication. Coumadin or Warfarin is a blood thinner. It's been in use for more than 70 years. It helps some people thin their blood or prevent undesired coagulation that can be harmful to them. There are others on the market. Some people will take Plavix, Pradaxa, Xarelto, Lovenox, or others. But Coumadin is the only one that has a diet interaction, so the dietitian in the hospital will speak to those patients. When they are new on the Coumadin, we explain that part of the way the Coumadin works is it interacts with the vitamin K to slow down the normal clotting effect that the body has. It's normal for all of us to clot our blood when we have a bruise, a cut, or an injury. When the body is damaged, the body will take steps to repair it. When I hit a piece of furniture or a door and get a bruise on my arm that turns black and blue for a couple days, that has bent or broken my blood vessels and the blood is leaking out. To repair that, the body will form a clot over the breakage where the leakage occurs. Think of it as a small bandage or a small scab, which is slowing down the bleeding, and then repair the damaged vessels. When the repairs are complete, the clot that is formed will dissolve and go away to disappear, and it will no longer be needed until the next time I bump into furniture or something bumps into me. Vitamin K will affect Coumadin. If you eat a little bit of vitamin K, it'll have a little effect. If you eat a lot, it will have a large effect. Your dietitian or your doctor should give you a list of the foods that are rich in vitamin K. Some of those include the leafy green vegetables such as spinach, broccoli, collard greens, mustard greens, Brussels sprouts, cabbage, asparagus, but some of them are not green at all. They may be blueberries, blackberries, cauliflower, garbanzo beans, or liver. Your dietitian or your doctor will give you that list in the office when you begin taking the Coumadin. The dietitian's role is to explain the foods that are rich in vitamin K so that if you like them, you can consume them in a moderate or consistent amount. We never say never. We just say if you like these foods, you can have a serving every day or a serving every other day, and that is your normal and consistent intake. What you should not do is avoid the foods that are rich in vitamin K completely, and then at some point decide that you will indulge yourself with your favorite farmers markets of garden fresh spinach or blueberries or avocados or whatever it may be. A little bit makes a little difference. A lot of vitamin K will make a big difference. So a little bit makes a little difference as long as you maintain a consistent and moderate intake. It is actually not possible for anybody to have zero vitamin K. You cannot do it. You do not want it. Vitamin K helps us to clot our blood when we bruise ourselves, skin our knees, or have any other type of injury. We all have hundreds of different bacteria living in our gut, and there are some in there that will make vitamin K for whatever person or animal it's living in. It will make a molecule of vitamin K to squirt out and then swim in the other direction, and then later its cousin will make another molecule of vitamin K to squirt out and then swim in the other direction. These molecules of vitamin K will later be transferred in our bodies to our liver. The liver is a storage bank. It will store vitamin K, it will store vitamin A, it will store iron, and it will store cholesterol. So sometimes people find eating liver very healthy, sometimes people find eating liver not good for their health, and some people don't like liver at all. You should also avoid alcohol or aspirin unless you speak to your doctor to say if it is allowed on your current dose of Coumadin. Some doctors will allow it. Some doctors will say your dosage is too high and to avoid them. There are thousands and thousands of people in this country who take an aspirin every day in the morning. They don't have a headache, but the doctor has told them it's good as a blood thinner, a very mild one, and it helps their cardiac risk or cardiac health. Okay. Although some people find the vitamin K function with Coumadin an annoyance to keep track of or to bother with. It actually has a bonus effect. Vitamin K does act as an antidote or an emergency brake if your Coumadin level happens to be too high. If for some reason it has gotten out of the therapeutic range and your doctor, when he tests your blood, finds out, he can give you an injection of vitamin K, which will slow down your INR or Coumadin effect in 8 or 10 hours. Otherwise, you would have to wait 2 or 3 or 4 days for the blood thinner effect to pass out of your body. When you know that you're going to have a surgical procedure to take out your tonsils, have a tooth pulled, have a pacemaker or something, doctors do not want to commit surgery on someone who is on a blood thinner. Very difficult to control the bleeding, and he would tell you to discontinue it for several days beforehand. However, with Coumadin, if you have an accident, you've fallen off a ladder or down a short flight of stairs and you're black and blue and purple, in some serious bruising, or you broke your leg and the doctor needs to do surgery to fix your broken leg, he can give you the injection of vitamin K to slow down your Coumadin effect and your INR levels, take care of the surgery quickly instead of waiting 3 days, and then you can resume your dose of blood thinner after your surgical procedure is completed. You should get a list of the foods that are rich in vitamin K besides the ones I've mentioned from your doctor's office, from his nurse, or from the dietitian. Some doctors have a dietitian in their office. Otherwise, you can contact the dietitian in your local hospital and they'll be glad to share that information with you. I hope this has been informative for people who are new or starting on the Coumadin blood thinner anticoagulation. And I hope with this information, you'll have a very healthy life. Good day.